Yep, I am back. And so, well, we're sort of back. So we're going to try and start getting some videos out there. But this one video, I want you all to watch this video and share this video. This could be literally life-altering for some people out there. So stick around. I just wanted to add in here, if anybody ends up that you're in a position like this, please email me. My email is in the description. We will give you all the contact information that we can to try and help you out as best as we can. So thanks. Well, hello again, Internet. Welcome back to the channel. Yeah, we're going to do this video today, and we're going to be talking about bladder cancer and the treatment for bladder cancer. One of the treatments, which is a BCG induction for bladder cancer, and how it can be very life-altering. I'll just give a quick thumbnail. About 3 years ago, I ended up getting bladder cancer. We did surgery on it immediately. They found there was some high grade to it, and so their suggested post-surgery treatment was to do what's called BCG treatment. BCG treatment is taking a live tuberculosis virus and injecting it into your bladder, and that is to strip the lining away from your bladder so that any cancerous cells get removed in that fashion. In my case, it was if they missed anything, this would be to take care of it. They suggested a 3-year program on that because I did have some high-grade cancer there. And so I said, hey, these are my doctors, yeah, let's go with this. Any problem with it? No, it's a safe treatment, but it's not a pleasant treatment. We will say that. There's no numbing or anything like that goes on. And so, but we went through with it, and we had 30 or 33 treatments of this. December the 13th was supposed to be my very final treatment. Boy, I was looking forward to that. That's the last day that we actually dropped the video. And I talked about that's my last day. So, we were going to get into training. I've got some mountain bike cross-country racing that we're going to do this year. Wanted to get into training for that. And so I was real excited. Went through the treatment. Seemed okay the first couple of days, about normal. You don't feel good. You're sick. You sometimes will run a fever, and you're very sore and worn out. Kind of feels like your body's been beat up, but that's normal. But about 4 or 5 days later, I started getting some blood all night long one night. Now, it's not uncommon to do some bleeding within the first 24 to 48 hours. They can tear up some things as they're doing this, but this was different. This was very free-flowing bleeding, and it was pretty much all evening long. And immediately after that, I started with some other symptoms, and the symptoms were pain. It started out as very, very uncomfortable, but urgency to use the bathroom. When I say urgency, I mean every 5 to 30 minutes at the max. Oftentimes every 5 or 10 minutes, at the very max 30 minutes. And we're talking 24 hours a day I was experiencing that. The pain turned into really, it would double you over pain, probably worse than I've ever had. You cannot lay on, in my case, I could not lay on my side because that just added to the pain. So I had to lay on my back, was strictly on my back. Of course, that was hard on my back. And so I had to sleep in an easy chair on my back and still get up every 15 to 30 minutes. So there was no sleeping going on. So, you've got exhaustion. I'd sleep about 2 hours every 24 hours, and that was not even good sleep, maybe 3 hours because I would be down for a long time. But I got up so often, I'd only get 2 or 3 hours of sleep. Laying on my back, had my back pretty messed up. And, of course, the lack of the lack of sleep works on you, and the fact that this was my final treatment and something has went wrong, that works on you emotionally. So it was pretty debilitating. We called the doctors, and they said, well, take this oxybutanol that I've had to take in the past when I've had symptoms that were similar to this, but nothing in this category. Didn't work. We called the doctors back and said, look, you got to get us in there. So we come in. The nurses, they had said, well, we think what you have is urine retention, and so your bladder is so full, that's why you're having to go so much, and that would cause it to be sore. We're sure that's what's going on, so you just come on in, and we're going to have to put a catheter in you for some period of time, and that'll let things relax down, and you'll be fine. And we went in there, I said, I really don't think that's it. And sure enough, they checked me, and no, we was not retaining anything. So they said, well, it has to be a UTI infection. So they checked me while I was right there, and they said, there's no UTI here. We don't know what's wrong. Maybe you just need to go to the ER. Well, that was when I was very close to blowing up on the hospital, because they're the ones that did this to me, and to say go to the ER and start all over. But Michelle calmed me down. We went back home. The symptoms just never got any better. Never got any better. I went for maybe 3 weeks to a month of these symptoms going on like this, and it was constant every day. I managed to keep the business open with Michelle's angel help that she was doing, but we kept that open. But otherwise, there was nothing that I could do. And I mean, literally nothing. And we called him back, said, look, you've got to get us in there to see a doctor. Well, we might be able to get you into a nurse immediately. No, absolutely. Let's say we advocated very strongly that they needed to get us into a doctor immediately. And that did happen. They did get me an appointment the following day. This was with a doctor that was brand new. This was her first day on the job. But that's okay. She's a urologist oncologist. I wanted to get in and see her. Now, the other oncologist that I've spoken to, we had one of them contacted me the day I was seeing the nurses, that they said, well, we don't know what to do. And he said, well, I'm going to give you 2 prescriptions, Blaine. One of these is a little bit cheaper. It's not cheap, but it's cheaper. But I want you to try this and see if it works. And if it doesn't work all the way, but you see improvement, you can get this other one. And it's going to be about $250 or more for it. I said, that's fine. Give it to me. And he says, well, this one, first one is just a try. And so Michelle went up to the drugstore to pick it up. And I figured, there would be 3 or 4 days, maybe a week's worth of medication there to try. And she come back and she says, I don't think something's right here, because they gave me 3 months worth. I'm like, I cannot continue to go through this for 3 months. But we tried it, and it had zero results. And so that's when we contacted them back and said, look, you have got to get me in to see a doctor. And we made it very plain I needed to see a doctor. And so we got in. First day on the job, this younger surgeon doctor come in, and she looked at me and she said, Mr. McLaughlin, you have BCG-induced cystitis, and possibly a very bad case of it. We got a name to it. At least that's better than, oh, well, things are just all activated right now. So what we're going to do for you is we're going to give you steroids for 7 days and 2 weeks worth of antibiotics, pretty strong antibiotics, and you should feel better in a few days. And so great, we've finally got something that is making sense, not just passing this over. So we got the prescription, and that was on a Tuesday. I started the prescription on a Wednesday. By Friday, I had some improvement. I was far from good, but I could see there was improvement, and this was on to something. And this was steroids that you take a certain amount. I think it was like 30 milligrams one day, and then 25, and then 20. Well, by day 4, when we got down to, not as many steroids in the system, I thought I was going to end up in the hospital again, because everything just started flooding back. And so in this time frame, Michelle, she is an extremely good advocate, and she went on a search. I'd like to say we went on a search, but I wasn't able to do anything. Michelle went on a search because we had a name to this, and she found out a tremendous amount of information about this. And there are people going through this that go through this for a very long time. It's not as rare as what I was led to believe it actually is. And a lot of people are going through this, and a lot of doctors are missing this. And so we contacted a Dr. O'Donnell in Iowa, and this happened on a holiday. It was a Monday, Martin Luther King Day, as a matter of fact, and they were closed, but she sent an email to him, to 3 different emails, and told her told him what was going on, what we were going through, and wanted to know any suggestions he might have. Well, to our surprise, I'm going to tell you right now, Dr. O'Donnell is what the original doctors started out to be, and that is a healer. Much of the health industry is becoming just that, an industry, and it's not about healing, it's about an industry. But that's not the case with Dr. O'Donnell. He is the head of their urology oncology at Iowa State. He is also a professor at Iowa State, and he is, I think, possibly the leading expert on problems with this BCG treatment. And so he wrote us back that same day. He took time out of his holiday and wrote us back and told us exactly what protocol he would suggest for us, that our doctors could contact him at any time. He would consult with them without any problems whatsoever, and to let him know how things are going. And so Tuesday morning, we sent an email into our contact at the hospital, but we had already decided if they give any flack about, well, we want to try this first, we will be in Iowa by Tuesday night or Wednesday morning, and we're just going to transfer everything over to there. Well, my new doctor was actually very familiar with this man, and the place that she came from, they actually had his protocols posted everywhere that they do the BCG treatments. That's not the case at the hospital that I was at. And she was completely on board with it. She actually met this Dr. O'Donnell one time, and she had much respect for him and knew he, knew what he was doing. And so we got that plan started. We're in the middle of that plan right now. What that plan is, starts out as 1 month of very heavy steroids and 1 month of very heavy antibiotics, and it's heavy doses of both. That's the reason I can't be doing any e-biking. These medications, you're not allowed to jog. You're not allowed to lift very, much weight. You could rupture tendons with these. They do something to make that weaker. So there's no e-biking for right now, but we did see some significant progress in the first week with a very high dose of steroids. We dropped down from that to the next step down, and by the time we got to the third step, we had to go back to the second step. So at this point, I'm going to be on steroids and antibiotics for 42 days minimum. That's what we're set for. And if things continue to improve, that's going to be 42 days. I should be done with this by sometime in March. And that's when we'll get started on our training. It may take a little bit longer. Outside scenario, worst case scenario is tuberculosis could get loose in the rest of my body, in the bloodstream and things like that. And we're not anticipating that because we caught this relatively early in the process. So even though it was a severe case, we caught it pretty early. Here's the reason I want to get this shared, because my doctors, my original doctors, except for this one that started, they never even mentioned this to me. They were going to treat things, and they were going to treat them for months in something else. We have spoken to a lot of people through the internet that have been experiencing this, and we've been letting them know what we've found out, and some of them have found out the same thing. Some of these folks have been going through this for years, and what happens the longer it goes on, basically your bladder can calcify, which means you're going to have it removed. This is life-altering things here. Some of this BCG treatment is used to treat cancer. Some of it is used to what's called maintenance, to make sure that cancer doesn't come back. In my case, it was that it doesn't come back. But the fact that doctors are not recognizing this, and it is a relatively simple treatment for this BCG-induced cystitis. Yes, they're heavy duty and, drugs and steroids, but it's not really that invasive because you're not talking about surgery. You're not talking about years. You're talking about getting some relief right away. This needs to be posted everywhere, and we will be advocating with the hospital on this, that all the doctors and especially the nurses are familiar with this and that they get a protocol in place for this. And our goal is going to be to advocate for this at other places as well. And that's why I'm asking you to share this video with as far as you possibly can. I want to get this word out to as many people as I can, because you would not believe the number of people that we have communicated with that are just being tortured, have zero quality of life. And the doctors are not doing anything about it. They're not addressing this. They either don't know about it, they think it's too rare. Well, I'm finding there's a lot of people out there it's not that rare. So that's why I'm bringing this video out here. Let's get that out there. Do me a favor, share this video. We're going to be sharing it as much as we possibly can. I will be giving you some updates on this, along with we will be going back to riding our e-bikes. Don't forget, I do have some cross-country racing I'm going to be doing this year. You're going to want to tune in for that. Of course, Michelle and I going on our rides, we certainly share those kind of things. And if you want to see that, make sure you hit the subscribe and the like, because that certainly helps. But the e-biking is nothing compared to the importance of this right here. So we're going to be giving some updates. Again, hit that subscribe and you can catch updates that we do on this. I will be letting you know how this treatment is going. I'm doing a worlds better. If I never went through this, I would feel very, very uncomfortable and quite sore at times. After what I've been through, it's just a little bit of discomfort compared. So we'll be letting you know how things are going with that. And we might bring some other things to you as well. And we're going to get back to the e-biking. Fear not on that. But hey, that's going to do it for right now. I'll get back with you and share updates with you on this and how our advocacy is going. And so, yeah, until we get out another one, hey, Internet, this is Southern E-Biking. And you know what I'm telling you. Stay safe, God bless, and keep the wheels rolling. Once again, we're out.